Hi, it's Dr. Jen here. I'm a benzodiazepine withdrawal educator and coach. A few days ago, I posted a video to friends and families of anyone going through benzo withdrawal. And I realized that I failed to mention something really important. So I'm going to make this very short video for anyone who's interested in this one little point. And that is the vast majority of people who are getting off of a benzodiazepine, they are not true addicts in the sense of the word. They are chemically dependent upon their medication. They are taking their medication as prescribed. But even taking the medication as prescribed can still cause this chemical dependency because the medication causes damage. It's a chemical brain injury. And so to help live with that, the doctor will often increase the dose. That is known as tolerance withdrawal. So we'll actually go into withdrawals unless we get more. But again, that does not mean that we are addicted in the true sense of the word, that we're an addict. We are chemically dependent. So please know that your friend or your family member, your loved one, they're not an addict. They're chemically dependent, and they are doing their very, very best to minimize their symptoms of withdrawal and to get off this drug, or if they're off, they're doing their very best to navigate a very challenging medical crisis, because that's what benzo withdrawal is. It's a benzodiazepine injury syndrome. So it's important that we respect the journey that we're on, and it's important that we understand that they don't have an addiction. They're not craving their drug. If they do want to take more of the drug, it's not because of the way an addict would think about their drug. It's because they truly want to stop the horrific withdrawal symptoms. So I have been in the benzo community for 10 years. In those 10 years, I've talked to thousands of people. Only about 2 or 3 people in those 10 years have spoken to me and said, I know I'm addicted. I've been abusing this drug. I've been getting it from the street. I've been, taking some out of, somebody's loaning me some and giving me some, whatnot. Very few people have that type of a relationship with their benzodiazepine. The vast majority take it as prescribed, but even a prescribed dose, even a very small dose, even a short-term dose in some people can cause this chemical brain injury and cause a withdrawal syndrome. So I just wanted to clear that up and add this little piece to remind people, most people going through benzo withdrawal are chemically dependent on their medication. They have taken it as prescribed. They trusted their doctor, just like most people do. We trust our doctors, and they now have this chemical brain injury, and they are doing their very best. So going to places like, Narcotics Anonymous, it's not going to be helpful. I mean, those steps are helpful for everybody, but they're not going to address the withdrawal symptoms. And going to a detox isn't a good idea. Yeah, it's great if you're a true addict on other chemicals, other substances. Yeah, detox can work, but not in benzo withdrawal, because it shocks the brain so much to get off the drug so quickly that the symptoms can be life-threatening, or they're so unbearable that people just feel like they can't go on, so they will reinstate and then try to taper. So some of the things that work for true addictions, for people who have addictions, don't work for those of us in benzo withdrawal who are chemically dependent. So let's really think about those 2 words and use them correctly. When we're talking about somebody going through benzo withdrawal, usually, most people, they're chemically dependent. They're not a true addict. So I hope that that's helpful, and I hope that it helps friends and families have a bit more compassion for what your loved one is going through, that they have been damaged by the medical community because they trusted the medical community through no fault of their own, and they really are doing their best. So please, let's treat them with love and respect. And let's treat the addicts, the true addicts of the world, with love and respect as well. They've got their own issues, different than benzo withdrawal, but they have their own issues. Let's just treat everybody with love and respect. Wouldn't that be a wonderful world? Anyway, I just really wanted to clear that up because someone brought it to my attention that I did not address that. So I hope that this is helpful.